When I graduated from high school and I was 16, I had to have a physical to enter college. And at that time, they told me I had a heart murmur, which I didn't know that I had. And so that was my first inkling that, something could be wrong. I think I've always been a practical person. I like to do whatever needs to be done. If you need to paint, I enjoy painting. If you need to build a bookcase, I build a bookcase. If you need to mow the yard, I can ride the Kubota.
My wife is a very active person, and I had maybe detected some things like maybe she was slowing down a little bit, but it was sort of a gradual thing. She went in for a regular physical with an internist, and he thought he heard a murmur, so he referred her to a cardiologist. And so she was supposed to just have a follow-up meeting with the cardiologist and be out in a matter of minutes. And many minutes passed, and finally I called her and like, what's going on? She said, I've got a big problem.
The doctor told me that he heard a heart murmur, which didn't bother me because I knew I had had one. The doctor told me that you may have had a heart murmur when you graduated from high school, but this one was entirely different. He said, this is a much more serious heart murmur.
She called one day and said, hey, I went in for a routine physical and ended up having an EKG and all these sorts of different tests were run, and they think that I need to have surgery, and these are the valves that they need to repair and that they need to replace, and the only way to do that is open heart surgery. Of course, I was a little worried, scared. I know that she had done her research, and so at that point, my brothers and I knew that what we needed to do was support her and be there for her throughout the process.
So Melanie gave me a heads up about a month in advance that her mother may be having open heart surgery, and was asking if we had any relationship with the CVOR over at this account. And unfortunately we did not. Well, however, as time got closer and closer, she had the willingness to ask the surgeon to use Stryker sternal plating. So that's kind of naturally what kindled the relationship between Paxton and I and a lot of the staff.
Here at our facility, the physician assistant's role is to help with the closure of the chest and facilitate what is the best way to have that chest closed.
Well, I did not know, what was available, but my wonderful daughter, who is with Stryker, assured me that she felt that using a plating method would be much better.
When she found out it was going to be open heart surgery, and we started discussing it, I said, Mom, we've been getting really good patient outcomes. All the surgeons are saying less opioid use, the recovery time is much shorter. And so she started doing her research, and then they reached out to their surgeon and said, hey, this is something that we wanted to do.
I insisted, and in getting ready for the surgery, I came to understand that the doctor did not know if the med center had the plates, and my daughter assured me that, well, if they didn't have, she would make sure that they got them. And she also had one of her reps in the operating room with me.
With rigid fixation of a sternum, you will find that patients don't use opioids as much in the postoperative setting. I'm not saying they're pain-free, you just see less pain because there's no micro movement of the sternum. If you actually think about a sternum when it's cut, it controls your mechanism of breathing. When you take a deep breath and you breathe in, everything pulls, the rib heads pull on the sternum. So if you have a sternum that's just closed with wire circulage and you cough, there's a little pull because those wires are going to cut a little bit. And if you go to get up and move a little bit, it will shift, and that shifting causes more pain. With the sternal plating system, we found that patients typically require less narcotics to control their pain. Typically, they're up moving a little bit faster, and in long term, I feel like they do better.
I can't remember all the details then, but I do know that it was a shock to everyone how well she was doing. And she was up and walked the big loop, and was doing really, really well.
After I saw her in the hospital, I saw her several weeks later, and the change in her energy was much higher than it had been before. She was in great spirits. You could just tell that there had been a very positive change in the way that she was acting and she was talking and she was feeling. So although we may not have noticed big things in the beginning, I think after the procedure it was pretty obvious that this needed to be done.
It has not been something, that has negatively affected my life to any great degree. And I attribute it all to the surgery and the plating. I've not had not one stitch of pain.
We used to always say, hey, every single patient on the table, that is somebody's mom, that is somebody's grandma, that is somebody's sister. You just never realize that could one day be your mom. It makes me feel so proud to work for a company that I can stand behind and know that this is my mom and I'm willing to risk that and that it's going to be an awesome product.
I feel wonderful. I mean, if I didn't have the scar from here to here, I would know that I had had surgery.
Ever since I was a little girl, my mom has always been my hero. She's been a teacher her entire life. She's just somebody that I have always aspired to be. And she just truly has a heart of gold.